Kendall, this is going to be your clip.
What do you think?
Well, I don't think it's cardiac.
I mean, what do you think of the app?
I mean, it's hard to say without seeing the full thing.
Take a look.
Oh my God. Do you know how much time this will save?
Studies show you can spend 80% less time charting. You'll get out of here sooner, improving both patient and physician satisfaction.
Oh, excuse me. It says here she takes Risperdal, an antipsychotic. She takes Restoril when needed for sleep. So is that,
AI. Almost intelligent.
Generative AI is 98% accurate at present. You must always carefully proofread and correct the minor errors. It's excellent, but not perfect.
This is amazing. Chuck.
Okay, why did you pick this one?
I think before the season started, we were discussing like, what's going to be on the show. We talked about like AI because AI is like in every part of our life. And so like AI is like, it's not coming, like AI is like here, it impacts all of us. We use something similar. It's like an AI scribe, basically it listens to your patient conversation, like forms a note for you. And this has happened to me before. Like it's good. It gives you a good placeholder, but it's not perfect. It doesn't give the correct history all the time, but it's good enough. One time I had a patient that was like cursing all the time. They put all those curse words in there. Another patient said she was in a really bad pain. It put seven. I told you it put seven reallys in there. So sometimes it does stuff like that, and it's just like it's cool, but it's not. I do miss the in-person scribe. I miss them having them sometimes. Like if you have a trauma or something, you really like this. Our AI scribe, the patient needs to be in EMR to log them on to get the note going. And so if a patient comes in an emergency, you don't have time to put them in the system and like start the app. So I think having an in-person scribe was good for that point.
Yeah.
In ER.
Liz, do you have any AI tools you use in your day-to-day?
Oh yeah. I use AI every day. I use Open Evidence has an AI tool like for all of my letters of appeal. You guys won't have to do that, I don't think.
No.
Right? No, welcome to primary care. No, yeah, and especially it does obesity medicine, all of the appeals and prior authorizations and letters and stuff. So that's nice. Because it's also HIPAA compliant, and then like Docs GPT, the Doximity GPT has a scribe as well. Like that just listens to your to the rim. So you just have your patient be like, "Hey, do you consent to me using this tool so that I can make direct eye contact with you the whole time?" And everyone says yes. And there's lots of other tools that you can pay for, but I just don't want to pay for it because I think the Docs GPT one is like free. So
Do you feel like what they showed there, like and like Kendall was saying, like there's lots of hallucinations, like do you have to edit almost every note it writes, or some of them are good, or what are your experiences with it?
I think every note is about 80% good.
Yeah.
And that is a lot. That's like a lot better than me having to write the whole thing. So,
Have you used like in-person scribe before?
Oh yeah, especially in the emergency room because I went to residency at UVA and they had like a whole scribe program in the emergency room, which was incredible. They were really good. I think if you're watching this and you want to go to med school, be a scribe in the emergency room. Like you learn a lot, and yeah, I have loved that as well. And it's fun because when people are just starting out being a scribe, you get to teach them a lot, and I think like teaching is fun. So.
Yeah, and we had like a lot of our scribes were going to their college kids that were getting ready to go to med school. I wrote some of
Yeah.
patients even that got into med school, so it was a good training for them actually.
Yeah, it's crazy how like there's almost like this social aspect of it. Like you show up to shift and there's like all the scribes and almost every ER doc had one. And now like everyone uses the AI thing, so they're not there. It just feels kind
That's sad.
it is kind of sad because now it's like fewer opportunities for them to like learn and get like experience, or even know, like I think having a negative experience is also good, right? Like you say you're a scribe and you're like, oh God, the ER is terrible, I never want to be here. Well, that's valuable. You're not gonna
Yeah.
like,
Wait. Are the writers going to watch this? Because you guys should write in a scribe character because that would be really great. Like an undergrad pre-med who's a scribe working in the cast. That is a really good character. Like a long-term character who then goes off to med school. That'd be so cute.
Maybe Dr. Robbie will like get angry at the AI scribe because he does seem like a guy who's like set in his ways, and he'll get like a human scribe in this.
And then he'll get a college kid.
Yeah. Or maybe it'll be like his kid that he's kind of watching over.
Yeah.
Yeah.
And then like mentors him to become a doctor eventually. Like, oh my God, we should tell them. Guys, do it.
Hopefully they're listening.
No, I think the scribes, like the college kids that are scribes in the emergency room, are such a part. Like they play such a good part. They're so helpful.
Yeah.
Yeah.
What do either of y'all use any other AI tools, or like, so we talked about open evidence, we talked about like the scribe tools. Anything else you've encountered that either of you use?
No, I've heard of a few things I've not used. I heard that the Queen of Hearts, it kind of like reads the EKGs for you, which I
Yeah.
think can be helpful for like EMS and pre-hospital arrivals, but I've not used it myself, but only just the AI scribes, the only thing I've used so far.
Yeah, I've played with the EKG tool. It's pretty good. So, like, I mean, usually like we're gonna know if something is a STEMI or not. But I always like if I think it's a STEMI, I call it STEMI. I always scan it on that just to see what it says, and every single time it said it's a STEMI. So it I mean, it gets it right pretty good, and that's impressive.
I mean, I use
Yeah. Wait, what? What'd you say, Kendall?
Gemini for sure, Gemini, ChatGPT, but I don't use it for
Yeah,
medical stuff. I use them like,
Oh, yeah. Yeah. Well, beyond your typical up to date and Hippocrates, I do use open evidence a lot, like quite a lot, because it sources from NEGM and also the AFP now, which is great.
yeah, and I think ASAP has a agreement with them as well. So I think
Oh,
that's really
cool.
smart of them, like having those agreements in place with all the medical societies, because now we all trust it more. We're like, oh, it's like the same
Yeah.
as we would be looking, but it's way quicker. So I think it's nice. I think for like patients listening and whatnot, I think a lot of people think that like radiology broadly uses AI technology, which it does, I think, in certain specialties. But like in my experience, we don't use AI for radiology in any way in the ER. And I work at a few different ERs, and I haven't encountered it. I know there's like some like particular cancers and whatnot, like in terms of staging and whatnot, they'll use it for. But and I know like in drug development, it's like something that's very used very commonly. But I think there is a gap between, I think a lot of patients I speak with will say like, oh, are you using it for like, all your radiology or like all of these like things built into like the EMR? Is it helping you like make diagnoses? And I'm like, no, not really. So I think there's a gap between like if you turn on like CNBC and they're talking about AI in medicine, people think like, oh, it's like revolutionizing everything. And it's definitely making huge strides in like the things we talked about, but it's also like not like the future.
mm.